Hi, this is the NEU's weekly briefing on COVID in schools in a week when cases have shown some startling increases. This chart shows the ONS statistics, and you can see that while cases remain low at the moment, they are starting to show the same sort of increases that we saw in September. The Imperial College REACT study suggests that they are doubling every 11 days. All the nations in the UK are following the same sort of track as England, apart from Wales, which is significantly flatter. And we hope that's because Wales is ahead on the vaccination. In fact, areas in Wales that are showing increases are all areas that border England. The regions of England are also all much of a muchness, with the exception of the northwest, where we can see a really significant increase. School ages still at relatively low levels, and secondary showing a decrease, which we assume is due to half term, and will also be partly because some year 11 and year 13 children are now no longer at school. When we compare with the all ages, you can see that there isn't a significant difference between primary and all age, and these for all the areas, primary, secondary and the all age, we're at the place we were on the 14th of September last year. While those graphs look flat, that shouldn't give you a reassurance. When we plot on a log scale instead, and this is a log scale of PCR positive tests, you can see a very sharp increase. Now, a straight line on a log graph represents an exponential growth. And the Imperial College REACT study suggests doubling every 11 days. There's time for 3 doublings between now and the end of term, so that we could imagine cases going from 9,000 a day, 1 doubling to 18, 2 doublings to 36,000, 3 doublings to 72,000 cases a day, and that is higher than the January peak. Now, this log scale graph does show a slight flattening, and so there is hope that the vaccination will flatten this curve. But every area of the country is showing now growth rates with an R above 1. On this graph, we are showing the areas where there are more than 200 cases per 100,000. Apart from North Tyneside, all of them are in the northwest. All told, there are 66 districts that have a rate over 100, including these that are over 200. But those that are over 100 up to 200 are spread across every region. So it's a problem that can appear anywhere. Despite cases going up, hospitalizations continue to be low. But you can see this graph on the arithmetic scale starting to pick up. And when you plot it on a log scale, you can see that there is some exponential growth of hospitalizations, but from that low level. Hospitalisation doesn't necessarily mean death, and there can be protection, obviously, caused by the vaccine, and the graph of deaths is still remarkably flat. And on the log scale graph, it does not show exponential increase in the same way that the hospitalisation or the case rate does. So that's the good news from vaccination. Get your second dose as soon as you can. Hospitalizations and deaths are not the only problem with letting the case rate rise. We'll also find that children increasingly miss face-to-face education. And this graph of school outbreaks shows that there were a number of school outbreaks last week. Not as many, nothing like as many as in the autumn term. And they're slightly lower last week because of the effect of half term, but still there. And when we look at this graph, which is looking at the number of children who've had to be off because of COVID reasons, just going from the 8th of March, you can see that in the 8th of March there was a very quick and sudden increase in the number of children who had to stay at home. After Easter, because cases were low, the number of children who had to stay at home were low, and it didn't increase very fast for a while. But now from the 7th of June, after half term, you can see that while it starts low, the rate of increase looks as bad as it did on the 8th of March. And so there is a real worry, if cases go up, that more and more children will miss face-to-face education. And in the last week, we've got data for 7,000 children were off school because they had the virus, 11,000 because they suspected they had the virus, but 72,000 were off because they were self-isolating, because they were a contact of someone with the virus. For all these reasons, we say mitigations are really necessary. We really regret that Gavin Williamson removed the prescription for mask wearing. The Welsh Government today announced that they were keeping masks until at least the end of this term. And schools have the freedom to do this, and we think secondary schools should have mask wearing. There is much less chance of spreading the virus and therefore of children being off. Ventilation also still really matters. In-person staff meetings shouldn't be happening. The other thing that we need to work on together is the mass testing. And on this graph, we're showing that there has been a significant decline in the number of secondary pupils who are submitting LFT tests on this twice-weekly basis. We've gone from a place where it was about 60% of secondary children down to only 14%. Now, SAGE suggested that mass testing and mask wearing together would reduce transmission in schools by a third, and that's the equivalent of 0.1 of the R rate. Now, taking 0.1 off the R rate, not only would that improve the situation in every school, but it would improve the situation for our society. So we want government and we want schools to work on getting mass testing rates back up, and we want mask wearing. The vaccination is still progressing brilliantly, and we have emailed all our members now aged over 18. I was surprised to find we've got 280 members aged 18 to 20, and we've emailed them, as well as everyone else who's older, to say they can now book their first dose. 40-year-olds, if you have a 12-week gap to your second dose, you can cancel and rebook on 8 weeks, and we'd urge people to do that. It's vital that people do get vaccinated. And we say it's vital because the vaccine effectiveness is still really strong, even on the Delta variant. The bottom part of this graph shows that after your second dose, you are 94% protected against going to hospital, even with the Delta variant. The protection isn't quite as strong after the first dose, and it's not quite as strong as against the Alpha strain for just preventing symptoms, but it's still really worth doing and fantastic protection from these vaccines. The NEU is continuing to maintain its school COVID map, to have health and safety advice, to have education recovery advice. If you've got a problem in your school, for you personally, get in touch with our advice line. Thanks for watching and listening. Please share. Let's be safe together.